Hello and welcome to the Black Complementary Therapist. I am your host Pauline and I am a massage therapist based in East London near Canary Wharf. And in today's show I thought I'd share something that, again, we often don't talk about enough, but perhaps we should. And it's the subject of what clients don't tell you before they book an appointment that they probably should. Now, before anyone gets judgy on me, this is quite a normal thing. People don't want to be judged. That's why I said don't get judgy on me. And people don't want to be judged because they may feel that there is a certain negative value to something that they have. So say, for example, you have a cold or you have a condition you're slightly embarrassed about. Either way, what it means is when you don't tell your massage therapist, there's less of an opportunity for a massage therapist or a complementary therapist to make adjustments to your treatment to truly personalize your massage. And that is an issue because if your massage isn't personalized for you, then how are you being treated? If you want a massage therapist who wants to address issues that you bring up, then perhaps sharing those issues is a good place to start. So think about massage. Massage is not just having a rub down. It is healthcare adjacent bodywork. And that means we work with you and your body's condition in order to address issues, calm and relax the muscles, and leave you better than we find you at the end of the treatment. So today we're going to talk about some of the most common things that clients tend not to share before an appointment, which they probably should. Let's talk about what most massage therapists and complementary therapists know really well, the common cold. So we may hear statements like, "It's only a little cold. I'm not contagious anymore. I nearly cancelled.
I just need the massage because I feel run down."
Now, I understand the temptation. When you're feeling achy, stressed or blocked up, massage can, we know, it feels comforting. But here's the issue. If you've got symptoms and your body's trying to heal, is massage the best place for you? Really? Is it really? Now, don't get me wrong, I worked through the latter parts of the COVID era. Remember that? And I got through it, and I think over the 3 years or so of the pandemic or whatever, I had COVID twice, both asymptomatic, and so for a very long time I was wearing masks. So I understand if someone has a cold, maybe just the beginning of it or something like that, then I wear the mask generally. And I wear the mask generally because I've got to go home and share my home with somebody, and I don't want to give them a cold that I picked up from somebody else at work. Simples. So bearing that in mind, it's important to think about whether this is the right time for you to come in for a treatment. So if, for example, you know it's hay fever, fair enough. You know it's an allergy, fair enough. But if it is a cold and you've got a sore throat, runny nose, you're sneezing or coughing, and you feel hot and bothered, i.e. feverish, give it a rest, stay at home. Me now want to see it. Okay? Thank you. I mean, the other side of it is that I work for myself. I'm self-employed. So if I catch a cold from somebody else and it's a pretty nasty one, I'm going to be off for a week or two, and that's not so good. Or if I decide to work, then I need to be masked up if I feel somewhere in the back of my immune system I have a cold. So it cuts both ways. It is good community-spirited, good mindfulness community-spirited action to say, I take responsibility for my dis-ease. I have a cold. I'm not going to spread it. I'm going to stay at home. Bearing that in mind, most massage therapists have a 24-hour cancellation policy, but if you're ill, reschedule, yes, why not? And that way you keep your money and you can book a next time and it's all good. And you'll really feel the benefit of it in the recovery phase after you've had your cold. A very common omission, I think it's best to fess up if you're pregnant. So Sometimes clients don't mention it because it's early, we don't know yet. It's an issue of privacy. Why should I tell the massage therapist if I haven't told anybody else? It doesn't matter, I'm pregnant. What's the big deal? A massage is just a massage. It won't affect anything. These are some of the statements people may feel are acceptable during pregnancy, but if you're pregnant and you want a massage, it's not a problem. But the massage therapist needs to know for lots of different reasons. So there is a separate treatment plan for pregnancy. Positioning changes, so a lot of pregnancy massage is done side lying. Reason, there's less pressure on the abdomen. It's easier for the mum to breathe, especially during the later stages of pregnancy. But some mums don't show until advanced months even. So either way, it's important that we know so that we can provide the right bolstering and positioning and cushioning that we can do at the time. In addition, treatment plans change. So often when you don't share information, it's difficult to know what a client's goals are, and pinpointing pregnancy is incredibly important because sometimes treatment goals change. So treatment goals might be, I've got pelvic pain, or my lower back hurts, my SI joint is giving me jip, or I have some form of sciatica or piriformis syndrome. A lot of things there. It may be an issue of I find it difficult to breathe, and maybe the treatment plan will be slightly different for different types of people. So say, for example, I might do rib breaking, some work around the rib cage for individuals who want help to deepen and lengthen and bolster their breathing, whilst a pregnant mum might need or care for a more gentle approach to assisting with breath work, which is more directed than physical intervention. I can remember one time someone coming to me and they said that they had fallen off their bicycle and they were pregnant and they wanted a massage because they were bruised in different places. So I had to ask about how they were feeling, and I had to double down on the fact that I thought it would be best if they went for a checkup first. So let's get this straight. Massage is not a problem in pregnancy. In fact, it's perfect for pregnancy. But what I would say is it's important that informed consent is given, and I need to practice due diligence as well in my work. It would be really bad if I just went ahead and treated every massage client the same. I can't do that. It's not in me, and it's not in my scope of practice to just treat each client the same. So bear that in mind when you book an appointment and you're focusing on what you'd like as a massage treatment. So bearing in mind that massage is actually deeply supportive of the pregnancy process. For example, easing muscle pain and reduce swelling, improving relaxation, helping sleep, and that sense of emotional support as the body changes is incredible. So bearing that in mind, it's important. So pregnancy massage can be deeply supportive. It's great for easing back pain, the sense of reduced swelling, also improving relaxation, and also that emotional support that you get during the treatment. It's a great comfort to the body as the body changes because it provides that feedback. Yes, my body's changing, but I'm working with it, noticing those areas of tension. And lastly, actually aiding in sleep. And sleep, as always, is huge. There is so much that goes on during the sleep cycle, that point of relaxation where all the body repairs. There used to be a TV show when I was younger called, I think it was called Only When I Laugh, and it was about a hospital ward, and it had this song at the beginning, which was I'm H-A-P-P-Y. I'm H-A-P-P-Y, I know I am, I'm sure I am, I'm H-A-P-P-Y. And it was about only when it hurts is it noticeable? Is it bad? Clients minimise pain, and I think it's because we do learn to live with pain. For example, 3 weeks ago I had really painful knees, and in the end I went to a physiotherapist on the NHS. Yeah, those abroad, it's a really weird thing. We in the UK pay into the NHS, and then we can go to the doctor and not get billed because we paid already. And then they will refer us to who we need, and they don't ask for money. We don't get billed because we paid for it before. And then we get a treatment plan. It's great. Anyways, it only hurts sometimes is an oft said thing when someone comes in and says they want a massage, but it's for a pain that only hurts sometimes, because we minimise things, and we shouldn't. We should actually say, you know what, this is giving me pain, whatever this is or that is. So it's incredibly common. Older adults often say it because they feel it's some sort of rite of passage that they should be in pain and deal with it in a stoic way. People feel like they're getting on with it. Women often feel like they're getting on with it simply because there are things that they have to do that they can't stop doing even though they're in pain. And this can delay treatments. So often in the treatment room, I encourage my clients to get referred onto somewhere so that they can get issues dealt with. So a client might say to me, my shoulder's fine. And then 5 minutes later, yeah, but I haven't been able to lift my arm above here for ages. And this is an issue. It is an issue. Or the other one might be, my knee's okay now. But then they find it difficult to turn over. And I guess for them, it is now their new normal, that they find it difficult to turn over, or they can't rest in a certain position, or they can't reach up in the way that they used to be able to reach up previously. So, yeah, you've got to name things. And when you name things, it's important. But the people who are best at naming things are those with a degree and a specialism in medical care. You bring that diagnosis to me, and then I can do an assessment and work with it. That's how it works. So, say it first. So say, for example, my hand hurts. You say it. My hand hurts. Then describe the pain. Is it a pain when you grip things? Is it a pain when you let go of things? Is it a pain when you twist? Is it a pain when you tighten muscles, stretch muscles? All of those things. Those descriptors really help the massage therapist to get a handle on how to treat you. So if, for example, you've had recent treatment or a diagnosis for something, it really is helpful during the treatment process as well. You don't need to use medical language. Sometimes it's like, is it a sharp pain? Is it numb pain? Does the pain start one place and end another? Is it referred? For example, if you have knee pain, is it when you climb the stairs? Is it when you go down the stairs? Is it when you turn? Is it when you stop? Is it when you're walking downhill or uphill? These are really important factors. Medical language is important for doctors, but for the common layperson who doesn't have a diagnosis, the description of what they have is ever so important. And any massage therapist worth their salt will listen very carefully during the consultation and during the treatment for what's up with you so that they can treat you in the best way possible. Another key area is medication. But we're going to lump them together with stress and emotional states. These 3 areas, medication, stress and emotional states, key areas because they are ones that are often overlooked. Because medication, you take that. Emotional stress, you deal with that throughout the day. It's part of your everyday life. Emotional state also can affect your treatment and how you interact with the world. So of course, as a massage therapist, I'm constantly aware of how I can possibly help with these conditions and stages, life stages, for you to enjoy the treatment a bit more. So sometimes clients forget to share information about changes in medication. What if you're on a blood thinner, or you're taking immune medication that means you bruise more easily, or you're taking a medication that makes you dizzy? These are important things to know about. If you're on new antidepressants, it may affect your mood in such a way, or your wakefulness in such a way, that perhaps massage at that time may not be a good idea. Or perhaps the timings of when you have your medication may affect how you feel at a certain time of day, and so we can make accommodations for that. It's important for a massage therapist to know, just in case, so that you're at your best when you come in for a treatment. A lot of patients say they are fine and they can get on with things and we can just go ahead with the massage treatment. But if you want to reschedule, that's a good time. It's a time when you know things aren't at their best, and so you want to come in when you will get the most from your treatment. Sometimes stress is a difficult one, whereas a person's holding themselves together, really holding themselves together. And the extremes of stress, where you're holding things together, may be that you feel at any moment you're going to break down. At any given moment you're just too tired to deal with things, that you respond in a disproportionate way to things that are not necessarily a threat. If that's the case and you need a massage, make sure you get some rest beforehand and then come in for the massage and then get some more rest. It is so important. We tend to push through stress, push through with work beyond the bounds of what our bodies are capable of, and yet these things we do. And sometimes in the massage room, when our bodies are at their lowest point with stress, we witness as therapists those moments. Some people call them breakthroughs, some people call them just stress responses, and they can be shallow breathing, jaw tension, inability to relax, tears during stillness, flinching during a nurturing touch, chronic guarding. These are very normal symptoms for the stress response. Now, I'm not a psychotherapist, but working with individuals who are highly stressed and easily triggered at any given time is one of the things one learns to do. As a massage therapist, I can't just plow on and keep doing a set routine while somebody is obviously going through some symptoms like these. So my job is to constantly check in and see how you are feeling so that I can respond to that. Now, it may be that a treatment may be cut short, may stop so that the client can get a glass of water and relax a bit more away from the massage table so that we can continue. It may be that we'll have to cut the treatment in half and I'll say, let's take a break from this and you can come back a bit later or tomorrow to continue on with your treatment. I mean, the way I see it is I want you at your best and to feel relaxed. And if you are feeling overwhelmed by the stresses of life, this is something we really do need to work through together. Doing this makes a safer space, and one where even though your body's responding to the stress, you have the intellectual right to say, this is a bit too much at the moment, let's continue this another time. And I think a compassionate treatment room is really key to acknowledging and responding to those who are in a stressful, anxiety-ridden state. One of the areas people often think about is I didn't know that it mattered areas. For example, issues of hygiene and skin. So often people have skin conditions. So say, for example, you've got dermatitis, so you've got a condition of inflammation of the skin. The skin is a barrier to the outside world, and that barrier sometimes breaks down in different sorts of ways, and where the skin barrier breaks down, bacteria can enter the body. So say, for example, you have some form of flare-up with eczema or something like that. That is a time when the skin is very tender, and those flare-ups of broken skin don't take too well to oil, don't take too well to handling. So in those conditions, it's good to say, at this moment in time, I probably won't have a massage. However, if your eczema is post-flare-up, if it's just dry skin, etc., then no problem, massage, go ahead. But some conditions are contagious, and some are fungal infections, some are unexpected rashes, but on top of that, you may have just had a tattoo. So if I see a tattooed area on the arm, I won't work that part of the arm simply because it's an open wound, and it's a point where infection can occur and a great deal of discomfort. With that in mind, why massage that area? It would be an area that I would avoid. Open wounds and sunburn are two other points where one wouldn't actually want to massage a particular area. One needs to heal and to recover from that sort of thing. And also recent cosmetic procedures, so if someone's just had Botox, no face massage. If somebody, and also if they've just had Botox, it's going to be difficult for them to be lying on the massage table face down, so one would need to make accommodations for that. So perhaps side lying position would be more advantageous in that sort of situation. So if you've had surgery or fillers or some sort of procedure done, massage is probably not the right time to be dealing with those. If you've been for surgery in the care of the hospital, often you'll have an exit chat where they will sign you out, and that means you're back from the consultant's care and they sign you back into the care of your GP, your general practitioner, and that way you know, because you've been signed off, you're okay and good to go for other treatments and therapies if you wish. That is after post-surgery or some sort of condition. So let's be compassionate here. Some people hide things for understandable reasons. Some fear judgment, some fear cancellation fees, some are embarrassed about their bodies. Some grow up being told to minimize pain. Some people, especially carers and important figures, don't like to show that they're in pain or discomfort. Within Black communities especially, we're often charged with the task to just carry on. But therapeutic relationships rely on truth being told. You don't have to arrive polished and pain-free. You just need to arrive with the truth. So if you take one thing from this episode, it should be that massage therapists just need the truth. We just need information. The more safety and honesty that we get, the more effectively we can work together. And sometimes the information that you almost don't give is the very thing that may make your treatment more effective. Thank you for listening to the Black Massage Therapist. If this episode resonates with you, feel free to share it, review it, and give it 5 stars. And remember, communication is easier when we care. You can connect with Pendulum Massage on Instagram, LinkedIn, YouTube, Spotify, Apple Podcast, Podcast Addict, and all them there places. Until next time, move gently, talk softly, think kindly, and take care of yourself. Bye.